My name is Anne Marie, and I'm a registered dental hygienist. I've been a dental hygienist for 11 years, practicing in both public health, periodontal background, and general practice. I became interested in becoming a dental hygienist. The long and short of it was after I left a business career working for a senior vice president of a bank, having a family and wanting to contribute to the family finances, I started working part-time as a receptionist in a dental office. And through a series of events, moved from one position as the receptionist to claims coordinator and then into a dental assistant's chair. That's where I was trained on the job. It was there that I realized that I definitely liked the clinical part of it, but I wanted to do more. I wanted to be not only more independent, but I wanted to be more involved in the patient's care. So we're going to start off with your oral exam first, okay? What it's like to be a dental hygienist in a dental practice is, first and foremost, it's very busy, it's fast-paced. You have to be a quick thinker. You might, have a scheduled appointment, but there's nothing carved in stone what happens from the beginning of that appointment to the end. It evolves just as the patient's in the chair, from one type of treatment to another, to you may be actually having to temporarily leave the patient to assist somewhere else. You are constantly being part of a team. You need to kind of be able to sit back and help anybody else in any other position in the office, because they might need backup. A typical day on the job for me would be arriving to work approximately about a half an hour before your patients arrive. You come into your operatory, you start going over patient charts and their records. You start preparing your own little notes, so to speak, of things that you might want to address with certain patients. You prepare your operatory, you make sure everything's clean and in place and that you're completely set up so the time that you bring your patient into the operatory, you're ready to go right from the beginning. You do that anywhere between 8 and 10 times a day, depending upon how many patients that you see. The end of the day is obviously making sure your records have been completed, as far as you have to put in your own notes, as far as what you did with that patient, any recommendations you might have made. And then you basically break down and prepare your room for the next day. The type of person I feel would be really good at hygiene is obviously someone who's detail-oriented, energetic, self-motivated, self-critical, because you're always not just assessing your patients, but you're assessing your own ways of how you treat your patient. You need to be independent. You need to be able to redirect your skills from patient to patient and from circumstance to circumstance. So you have to be a critical thinker and a quick thinker. And you have to be a caring individual, because you really got to care about that end result of working with the patient. It isn't just the treatment plan itself, it's what it's going to make a difference with this patient, what it's going to do for them. The training that you need is a minimum of an associate's degree in liberal arts and an associate's degree in dental hygiene, again by an accredited school. That accreditation comes from not just an awful lot of classroom work, but it's the clinical aspect that comes with it also. It teaches you how to apply what you've learned in the clinical atmosphere. There is continuing education and training involved with not just maintaining your license, but to be able to solidify what you do on a daily basis. The requirements vary state to state. In Massachusetts, for example, you have to complete 20 credits of continuing education in a 2-year period. What I like most about being a dental hygienist is making a difference in the lives of my patients. I get to meet 8 to 10 different people a day. In many circumstances, they forget that the mouth is connected to the rest of their body, and that in many cases we're the person that first sees signs of trauma or signs of disease, and you integrate and you formulate a type of treatment per patient that the end result is always going to be the well-being of that patient, and that's what I enjoy most about it. My advice to anyone who is considering a career in dental hygiene is to first and foremost do your research. Find out exactly what a dental hygienist does. Pay attention when you go to your next dental visit. See exactly what she's doing for you and how she works as a co-therapist with your dentist. And start looking at accredited schools, what schools in your area that you can go to. visit the schools, spend some time with an advisor, get all your information, and then just move forward with it.